services labor, and the provider of labor is a human being. On the side of health, mambo ni mawili nimeona yale changamoto kubwa. Changamoto ya kwanza ni sisi viongozi tumeingilia mfumo ya healthcare. Unapata kama system ambayo ina manage healthcare ya Wakenya wenyewe ni wenye tu wanaongoza nchi. Jambo ya kwanza, system kama hiyo ya IT, it must be owned by the government of Kenya. Jambo la pili, na hiyo ni changamoto kubwa, and I said I'll be mixing language, is the issue of funding. I have looked at the amount of money we collect in our healthcare system, in whatever name you call it, the previous one of NHIF and the current one. And whatever we say, whatever we promise, the point of the matter is that there is a funding gap. And my proposal is as follows, that starting the year 2028, the amount of money Kenyans are contributing into NSSF, ile ya pensions, ya retirement, we have that percentage, we reduce it by 50%. That extra 50% reduction goes into healthcare, and that will add into our healthcare system an extra 40 billion shillings, ambayo itapea wa Kenya afya mwafaka na yenye hawatakuwa narudi kwa mfuko kulipa. Many families have been ravaged by bills. As much as we are talking as leaders, we must provide practical solutions, and that is my practical solution. Within the same kitty of around 40 billion additional, it is enough money to take care adequately of all emergencies that meet Kenyan families, and also the chronic illnesses that are reducing many families into beggars. Hiyo pesa inaweza kufanya hiyo kazi. Na jambo lingine katika healthcare, the same money is enough to upgrade enough institutions here in Kenya, healthcare institutions, so that we can bring India here into Kenya instead of Kenyans going to India. And we'll be transforming these institutions so that they serve Kenyans and the region also. The last thing I want to give in terms of healthcare, I have interacted with many doctors, and I have interacted with many healthcare professionals. Dear Kenyans, we must bite the bullet. It is clear that Kenya is ripe. Again, I give an example for an equivalent of TSC. Even in healthcare, Kenya must have the Kenya Doctors and Healthcare Workers Commission that will be managing the affairs of our doctors and healthcare workers. And I am saying this knowing that it is a devolved function, but laws are made for the man, not man for the law. You can imagine now that a doctor in Nyamira, if they get married in Kwale, they have to quit their job in Nyamira and seek a fresh job at the other place. If we have a national platform to manage our healthcare workers, this will be a good opportunity, first of all, to harmonize. Number two, also, to ease also their welfare in terms of transfers. And so that also, we have a united front when it comes to staffing of our healthcare facilities. The other issue I want to give, which have really troubled my mind, is the issue of jobs. The other day, I got a committee from one of the churches in my office, and they were coming to invite me for a function, a church function. There were two ladies in that committee, and just during the introduction, one lady even cried, even before they told me what the agenda of the meeting, why they had come to my office. Because the lady has a son who is a doctor, who is doing vibarua. The other lady in the same meeting has a pharmacist, also